You with Health Beat, I'm Mia Malan. We've just celebrated Freedom Day, and our April show looks at health challenges and triumphs in our 30 years of democracy. We're fortunate to live in a country where tobacco legislation protects non-smokers, where women can access legal and safe abortions, and where HIV and TB remain serious but treatable diseases. Today I'll be discussing health in our democracy with Fatima Hassan from the Health Justice Initiative and with Vuyiseka Dubula, a former head of the Treatment Action Campaign and now from the Global Fund to Fight AIDS, TB and Malaria. But first I'm joined by Professor Malugapura Magoba, who's had a varied career as a Vice Chancellor, Immunologist, Eskom Board Chair and our Health Ombud. Professor Magoba, thanks very much for your time today. We've had 6 health ministers over the past 30 years. How's that impacted on health policy?
Each one of them have left a fingerprint of their existence in that portfolio. First of all, we had Minister Nkosazana Zuma, who set really the blueprint for the national health system in South Africa as we know it, by amalgamating the different health systems that existed in the homelands and in the various provinces. She is popularly known for having abolished smoking in our country and made it a healthier environment. She was then followed by Minister Shabalala Msimang-Manto, who was part of the AIDS denial era and really almost took us back in trying to address the pandemic of HIV and AIDS by pronouncing certain funny remedies for the treatment of HIV/AIDS. And she was followed very briefly by Barbara Hogan, who actually terminated, I think, AIDS denial.
So as you've mentioned, people like Nkosazana Zuma did great things in terms of policy, but there was also bad things. There was Sarafina, the scandal.
Correct.
And same thing with Zweli Mkhize. Yeah. He got lauded for how we handled COVID, but yet there was corruption.
Yes.
How do you view this? How does that impact our health system?
It appears, as many people have said, that corruption is in the DNA of the ANC. So it is no surprise that there is so much corruption. What one can say is that we put a lot of ideas into how the new health system should be. And lots of ideas, lots of policies, but it is in the implementation of those policies that we have failed. Right now, we have been debating the national health insurance. Everybody accepts that this is the best policy, and this is almost a transformative policy for the country. But where is it bogged down? In the debates and the contestation of governance, of how it would impact on taxation, how doctors would migrate from the country if it's brought into being.
What is your take? Do you think it's really the answer to our health problems, to fix our two-tier private and government health system?
Health, wherever you look at it, whether you are giving it universal or not, it's expensive and it has got these elements that are often not all in harmony to provide the best service that you can get. Now, I noticed that the minister has said that we should implement it in an incremental manner. You have to do it empirically. You learn as you go. Let's get a few centers accredited properly.
Let's look at our current system. As you've mentioned, there are many gaps in it. And you've been the health ombud for 7 years, until quite recently last year. And you supervised investigations such as Life Esidimeni or the working conditions at Rahima Musa Hospital in Johannesburg. What does that tell us about our health system?
First of all, it's got a leadership problem across the provinces and across the many hospitals that one visited. There's a leadership. There is a problem of governance. There is a problem of infrastructure. There's a problem of staffing, a problem of attitudes of professionals within the system. So we have a multiplicity of problems that I think hampers the national health insurance and the health system.
Just as an ordinary citizen of the country, do you feel sad when you look at that?
Well, I feel sad, but I don't feel that I should then lose hope. South Africa is my home. Like every South African, I want to live in a country that is successful, that is flourishing. I am sad that some of the things that I have recommended have not been taken forward.
Which things have been taken forward that you're happy about?
For example, in the life esidimeni example, the government, I think, admitted that they had committed a lot of what I call human rights violations. The Gauteng department admitted that. I made my recommendations from life esidimeni, and Ketani lost her job. And so did the senior level of that department. Dr. Silebano lost his job. Dr. Manamela lost her job. Several of the directors lost their job. Now, I'm not saying that that's adequate, but that's one form of a response to the recommendations that one should look at.
Now, you've lived through many stages of health in this country, and one of the most controversial and difficult stages was the HIV denialist period. I remember it myself as a reporter reporting on it, and I remember that you were one of the few prominent figures who were willing to speak out and take a stand.
What was really for me the most disturbing thing was that politicians in our country had the guts to think that they can define and determine what medical professions understand as a disease and push through the political power to determine the direction of health.
Do you think we've learned our lesson, that we've learned politics should not triumph science?
No, we haven't. It continues. It was the same thing in the life esidimeni. Politics was trying to triumph science because the former MEC had received so many advice, not only from the relatives of the patients, but from experts who were practicing in this field, psychiatrists, name them. They were all advising against this project that they were undergoing.
So, Prof, lastly, if you became South Africa's health minister tomorrow, what would you do in your first 100 days to fix some of these things?
For argument's sake, if I became a minister tomorrow, the first thing I would do is to have a CODESA on health. I would call all the stakeholders that are relevant to health and say to them, we are in a new country. We have a new constitution that is based on human rights. How is that reflected in the way we teach medicine, in the way we practice medicine, in the way we provide service in our country for our own people, in the way we write or rewrite the ethics within this new constitution, and begin to say, we are transforming South Africa's health.
Professor Maghoba, you've borne personal witness to so many events during our 30 years of democracy. It was really good to hear your views.
Thank you very much, and all the best.
After the break, how are we doing on the HIV and TB fronts? Welcome back to Health Beat, and we're looking at 3 decades of health in our democratic era. From the battle for access to HIV treatment, where civil society triumphed over beetroot and garlic, to a more recent development, where we have a bill in the making, which, if passed by Parliament, will scrap the crime of buying and selling adult sex. But poverty remains, and with it comes diseases like TB. Although we've made significant strides in treating HIV, our new TB infection rates are among the highest in the world. This while TB is curable and treatment is free at clinics. Let's watch this report from Cape Town.
Genevieve Heinze lives in Masipumelele outside Cape Town with her children. 3 years ago, while pregnant with her 4th child, she discovered she was HIV positive.
I was feeling a little bit like vomiting noises, and then I was losing some appetite. When I reached the clinic is when they do the test on me, and then they discovered that I'm HIV positive. I started the treatment, but it didn't fit my body systemly, and then I went back to them, and then they changed my treatment that I was having.
Genevieve is one of 7.8 million South Africans living with HIV, and 75% of those are on antiretroviral treatment.
At first I was scared and I was afraid because I didn't know how people would react or how they would judge me.
But then she found others who were also positive.
Like I always tell them, we're all human beings. You don't need to be afraid, because if there is a problem, you need to come out with it.
Every few months, she collects her medication from the local clinic.
They draw some blood and then they do the testing, and then they give you the medication and they give you another date to come back to get the results. After the results, they'll give you another date to come in back to collect the medication.
Dr. Elsie van Straten, a public health practitioner at Inova Health Institute, is excited about the progress made in HIV treatment over the past 5 years.
We've actually made significant strides in a very short amount of time. We have this new medication, TLD. You only have to take it once a day. It's 1 tablet. Now, for the past year, we've been able to use it in our children as well. So this has made a significant difference. Another very interesting thing in the HIV field is that we can prevent HIV with a medication we call PrEP. It is a daily tablet. But we do see that even though patients are very excited to start the medication, it's very difficult to stay on this medication for a long time. And it can only prevent HIV if you take that medication every day. And we are starting to use it in some pilot sites in South Africa. It's a 2-monthly injectable HIV prevention medication.
In South Africa, about 55% of TB patients also have HIV. And these patients are at a higher risk of dying from TB, despite it being curable. But the advances in HIV treatment have made a big difference to TB.
We can now tell you within 2 hours whether you have drug-sensitive or drug-resistant TB by looking at your sputum. We also have very interesting things that we're rolling out for your chest X-ray, where a computer AI program can look through a lot of chest X-rays to see who might have TB and flag that for a doctor.
TB is highly contagious as it spreads through airborne droplets and is still the leading cause of death in South Africa.
Around drug-resistant TB, we have come a very long way in a very short time. In the past, we had to treat you for between 9 and 12 months. You needed a daily injection. A lot of our patients actually went deaf because of the medication. Where now it can be as short as 6 months and you don't need an injection anymore.
It remains a struggle to get both TB and HIV patients to keep taking their medication. But the good news is,
we really are at the best stage in history when it comes to both TB and HIV. We have extremely good diagnostics at the moment. You'll be able to be tested in a very short time and it's painless. We have prevention medication both for TB and HIV. And if you do have TB and HIV, we have some of the best medication we've ever had.
When you have the support system, it gives you the hope to continue. And I'm still living like a normal person, like any healthy other person.
As the Treatment Action Campaign leader for 6 years, Bhekisisa Editor-In-Chief was part of the battle to get free HIV treatment to South Africa. She now heads up the Community Rights and Gender Department at the Global Fund to Fight AIDS, TB and Malaria. She joins me online. Bhekisisa, you were an activist during a time in the late 90s, early 2000s, when the government doubted HIV science. What lessons have you learned?
The first lesson for me was, if it wasn't for the people rising up to the challenge of challenging government, we wouldn't be where we are in terms of ensuring that government prioritizes policy that saves lives, including the use of antiretrovirals as one of many other interventions needed to prevent HIV, but also to manage HIV from people who ordinarily would die if HIV wasn't managed. Second, another lesson is the use of the Constitution as a tool to deliver care in a context where we have a progressive constitution, but a constitution without political will, without policies, was not going to deliver care. It was just going to be a document that collected dust but didn't save lives. And we used the Constitution because our campaign, interpretation campaign, was really fundamentally founded on the basis of health as a human right. I wouldn't have 2 HIV negative children without that fight. I would not have had the power to prevent HIV from myself from infecting my partner if it wasn't for that fight. So at a personal level, I benefited, but I know that there were many losses. We lost many of my peers who died at the period when we were fighting.
As a result of that, people with HIV who use their medicine correctly can live as long as people without HIV. But we still have just about 400 new infections every single day. So what's the way forward?
Society itself needs to change and reckon with the fact that there are certain things that we are doing as societies that do not really work to our advantage. The inequalities in relationships are one of the contributors that fuels HIV and vulnerability. There's also an increase in criminalizing HIV. In this case, I'm talking about the LGBTQI community. There's an increase and an influx and wave of anti-homosexuality bills that criminalizes people for who they are. We know that has dire consequences for health in terms of prevention and for death. I cringe when people say it's un-African to be a homosexual. But who defines what is African and what is not African?
Let's move on to the disease that still kills the most people with HIV, which is tuberculosis. And it doesn't just kill people with HIV, it kills the most people of any disease in South Africa. And yet it's a curable disease.
It's a disease that follows poverty. It's a disease that follows racial divides, inequalities. It also is telling us that there are things that we are not doing well, the type of houses that people live, overcrowding in jails, not having infection control in hospitals, in clinics. What do we need to do? If we can increase our investments in TB, we need modern ways in which we can diagnose TB early enough and treat TB early enough. TB is threatening all the gains in HIV.
Thanks for Bhekisisa Editor-In-Chief from the Global Fund to Fight AIDS, TB and Malaria. After the break, health and the law since 1994. Many new health-related laws have been passed in the 3 decades since democracy. Fatima Hassan was at the forefront of some of them when she worked as a lawyer for the then AIDS Law Project and the Treatment Action Campaign. She joins me now online from Cape Town. Fatima, in 2002, there was a landmark court ruling where the government was forced to provide free preventative treatment for HIV-positive pregnant women that could reduce their baby's chances of contracting the virus. What could we learn from that for the future?
So the court action was significant because it was part of a campaign which took many years, but it was the last resort to try and compel our government to basically make ARVs available.
You were one of the lawyers involved in taking Big Pharma to court to prevent them from blocking cheaper generic drugs to enter the country.
So remember at the time, like we saw in the COVID pandemic, the ARVs were not available in many parts of Africa, including South Africa. And if they were only available through the private sector. So the case which we took to the Competition Commission using what we call competition law or antitrust law was to challenge the monopoly that these two companies had over ARVs in South Africa at the time, because of AIDS denialism. And that action spurred the introduction and the announcement of the first set of what we call voluntary licenses, where the companies, because they were facing this legal action and regulatory investigation, then announced multiple generic entries into the market for South Africa, which paved the way for cheaper generic ARVs in South Africa for use in both the public and private sector.
Now, about 20 years after that case, today we still have problems in accessing affordable medicine.
When those monopoly companies are able to dictate and determine whether you'll get supplies, at what price you will get it, what you have is a situation of artificial scarcity that's created. And Cabinet took a decision in 2018 already that they would revise our intellectual property laws to make it in line with what is permissible in terms of the international trade rules. And up until today, 2024, even though we've gone through a devastating COVID pandemic, the Minister of Trade, Industry and Competition, Minister Patel, has still not tabled the patent amendment bill in Parliament. But implementation is tied to whether you have a capable state, whether you have capable officials in the national and provincial departments of health, and whether you have a system that is not designed to extract as much corruption as possible.
So much of what we've been discussing comes down to unequal access to healthcare, which South Africa has been trying to fix over the past 30 years, but not successfully. And now there is a piece of legislation, the National Health Insurance Bill, which aims to address that. Is that the fix?
I'd like to think that it should be the fix. But unfortunately, it's, 30 years too late. This is a law that should have been introduced in 94 already, when we just, won our democracy. It's a law that's going to be challenged again by multiple groups on the right and on the left for various reasons. The implementation of it, like all other health laws in this country, is going to be so fraught because it's going to be subject to legal challenge after legal challenge. There's going to be so much confusion and chaos, and there's going to be efforts by multiple players, from across the political spectrum and ideological spectrum, to try and make sure that as few as possible provisions are actually implemented, and they'll challenge a number of them over the next 10 years at least for compliance with the Constitution. Whether that will work or not, I'm not sure.
Fatima Hassan, thanks very much for sharing your insights with us. That's our show. Here's to another 30 years of good health and democracy.